Storms tore through parts of the Eastern Cape recently, uprooting trees and destroying homes. Initially thought to be tornadoes, the SA Weather Service now says that there's no evidence that the area was hit by violent whirlwinds. Nonetheless, half a dozen people died because of the bad weather earlier this month. Amid reports that several clinics were hit, we ask how the Eastern Cape health system is coping. The Provincial Department Head, Rolene Wagner, joins us live from East London now. Thank you so much for your time, Dr. Wagner. Your province lashed by storms. How badly were you hit?
Morning, Tafuba. Thank you for inviting us to the session. The storms hit us. We've had several storms hit us across the last week. At this point in time, we've got 45 clinics that have been affected, as well as 5 hospitals. Of those that have been affected, we've had to close 6 of our clinics so far. And one of our hospitals, Winterberg TB Hospitals, had 5 patients. We're moving them out of the Winterberg Hospital to a nearby hospital. So it's quite badly affected.
Yeah, it's quite devastating. And we heard the health minister earlier this morning, Dr. Joe Pasler, saying that the Omicron variant is spreading throughout other provinces. So this is devastating for your response to COVID-19.
Yes, it certainly will affect our response where those clinics are affected. I mean, if we look at the types of damage that we've had, it's quite bizarre. We've had torrential rains, we've had severe hailstorms, we've had high velocity winds, we've had lightning damage. And our infrastructure has been affected in a number of different ways at these clinics and at these hospitals. Where the roofs have been blocked. Sorry?
Oh, sorry, please go ahead. I was going to ask how the infrastructure has been damaged, but I think you were going to go ahead and explain.
Yes. So, for example, the roofs, where the roof has been partly damaged and blown off, water has leaked in. So ceilings have been damaged. It's gone into certain units. So, for example, one of our hospitals in the Alfred Nzo area, it affected the pediatric unit and a particular cubicle where the water came in down through the ceilings and the roof, and we had to move patients out to prevent them from being affected. In other places, we had lightning struck our generator. So there, fortunately, we do have generator and backup electricity supply, but there have also been interruptions to electricity and water at different facilities. So the general area has been affected, and Eskom is attending to those. But in one of our hospitals, the generator, there were 2 hospitals where generators were struck by lightning, and we're moving to replace the one now while we're working off generators, the rest of the generators. But you can imagine, when your electricity is down, that affects a rural clinic, because one of our rural clinics pumps the water up from the river and then has to purify the water. So when the electricity goes down, it affects their capability, and we've got to take extra fresh water into that facility. So we work with the Department of Public Works as well as the local municipalities in times of disaster to address these issues and provide support to our facilities. But there has been extensive damage, and we're now moving to try and address the damage to our roofs. Most of the damage has been to windows, of course, that have been broken. And so it's to repair the windows, repair the doors, get the generators replaced, and then attend to general property. In one of our clinics in the Joe Okabi area, that particular clinic, the nurses' home as well as the clinic was affected. In the nurses' home, that's where our staff is accommodated. Fortunately, one of the rooms was spared, and we can move all of the belongings into that room and secure it. The clinic, unfortunately, was damaged, and we've had to close down that clinic in Joe Okabi. What our district managers are doing, they're engaging with local communities to see if there are facilities around those clinics that we could move the clinic into, just to be functioning and provide a service to the local communities. So we're in the disaster management phase, and we're keeping in touch to ensure we provide support.
Do you have any timelines of when you think you'll be able to get your infrastructure back to normal?
It depends on the extent of the damage, and in this regard, we are supported by the Department of Public Works and Infrastructure. Their teams are on the ground busy assessing the extent of the damage, and by Tuesday, as the reports firm up, we'll be able to identify. Some things are quite quick to get back to repair, So your windows can be repaired relatively quickly there. The roofs would be also not as long, but when we've got to replace structures, so if the nurse's home is damaged, to bring in temporary structures would take up to 2 to 3 months to get that sorted out. So we have to make alternative contingency arrangements to provide accommodation in those instances.